for healthy diet, disease prevention, your health maintenance, diet and health be the answer. Emotional health, healthy food and growth, whether young or old, diet and health be the answer. For divine health, longevity, seminars and workshops, health education, aerobics, weight management and beauty. No matter what your needs be, Giant and Health go take care of you.
Alright, today we are going into another session of presentation where we'll be talking about something very crucial, something very important, something I know is actually going to relate with your health. This is Health Talk. My name is Itoro Paul, a dietitian. I am the Chief Executive Officer of Diet and Health. Okay? Diet and Health is specific about how food can help you live a healthy life, how you can take food as medicine. And so today I'll be talking about preventive medicine. Many people may not understand what is preventive medicine. So listen and listen carefully so that you will understand what is preventive medicine. That it is good to prevent sickness before it occurs. And the aim of preventive medicine is the absence of disease, either by preventing the occurrence of a disease or by halting a disease and averting resulting complication. That is the major benefit about preventive medicine. Okay, so please, as you are listening to this, it's good for you to make sure that you do not, compromise the instruction. You follow the instruction religiously and see to it that you do exactly what is expected of you to do, so as to, get the best of this presentation. Okay. Now, preventive health care, or what we may call prophylaxis, consists of measures taken for disease prevention. That means you must take some certain measures, certain procedures, in order for you to guarantee that you will prevent one sickness or the other. That is to say, you can prevent diabetes mellitus, you can prevent hypertension, you can prevent arthritis, you can prevent cancer, you can prevent kidney disease, you can prevent many sicknesses that we suffer today. Okay, if you are ready. Now, there are certain factors I know that promote diseases, okay, and then bring about what we may call disability. Some of the factors are environmental factors. Some are genetically predisposed. Some people are genetically predisposed, so we'll call them genetic factors. Okay, then there are also some things we call disease agent. And then the other ones are lifestyle choices, what you choose to do that may not be healthy for you in terms of health. You choose to smoke, you choose to drink, you choose to live a sedentary life, you choose to eat one particular type of food, and so on. So all these are what we call lifestyle choices. The lifestyle choices are the dynamic processes which begin before individuals realize they are affected. So you need to note all of this. Then when you talk about sickness, we're equally going to look at what we call pathogens. Okay, that pathogens is an organism that causes disease. It comes from the environment. Infections occurs when viruses or what we call bacteria or microbes enter your body and begin to multiply. Okay, so disease occurs when the cells in your body are damaged as a result of infection, and signs and symptoms of an illness appear. So pathogens, that is to say, any organism that can produce a disease. These are pathogens. Any organism that can produce disease. So in preventive medicine, let's look at ways or levels of preventive medicine. That in general, preventive care refers to measures taken, I've mentioned that before, measures taken to prevent diseases instead of curing or treating. But I have come to understand that in our society today, 90-something% of the people are waiting for disease to occur because they believe there's hospital, they believe they can go to church and pray, they believe they can meet a doctor, they believe they can always get to any of the chemists or pharmacy to get drugs, and so on. So 90-something% of the people wait for the actual disease to occur, and then they will treat it. And then what are they treating now? They treat the symptoms. That in most diseases today, a number of persons treat the symptom. They treat symptoms, yes, of course. Because once you begin to have headache now, you may not know what must have caused the headache. So your major objective is to stop the headache. You have forgotten that dehydration alone can cause headache. You have forgotten that microbes, virus, bacteria entering into your system can cause headache. You have forgotten that, poor metabolic processes or high acidity in your body system can cause headache. There are so many things that can cause headache. But for you, you just feel headache, and then what you need to do, the headache is a symptom. So you want to stop the symptom. So a lot of people in our society today treat symptom and not the actual disease. But in preventive medicine, you are dealing with the foundation, the genesis of the problem. That is why preventive medicine is very important for whoever wants to prevent one sickness or the other. So here you will see 3 levels of preventive care. We have what is known as primary, preventive care. We have secondary preventive care. We also have what we know as tertiary preventive care. Okay, so I'm not going to bother to go into all of that because I want to hit the nail on the head so as for you to get the best from what I'm trying to present to you now. Now, the most important illness that lead to serious impairment, such as being bedridden, if you've seen somebody who is bedridden before, loss of mobility, or the needs care include high blood pressure, these are the kind of cases that can lead somebody to bedridden. Severe high blood pressure could lead to stroke. And then when somebody has stroke, that is bedridden condition. Overweight can lead to loss of mobility. Overweight can cripple the weight-bearing joint, the knees, making it impossible for you to work. It can lead to bedridden condition. Diabetes can damage major organs in your body, the blood vessels, capillaries, and many other conditions. It can even lead to blindness, so it could lead to bedridden condition. And then cancer. Many people today are affected by cancer. Cancer, when it enters into stages, like if you are in stage 0, no problem. Stage 1, no problem much. Stage 2, you are managing it. And then when it enters stage 3, stage 4, stage 5, that person gets to bedridden condition. And then another one that can also lead to bedridden condition is what we call osteoporosis, which is common among the elderly people. Okay, it cripples. It can also, suspend mobility. Weakness of the bone density is lost in what we call osteoporosis. So that it happens mostly to elderly people. So these are the conditions that can lead to what we may call, bedridden condition. There is another one known as neurological or neurodegenerative condition or disease. Neurodegenerative condition, a situation where there's a tremor, or a situation where perhaps you are no longer able to remember, you are no longer able to coordinate, you've lost the neural function of your body. That is what we call neurodegenerative disease. So this could be a dementia. It could also be Parkinson's disease. So this must be prevented with the optimal individually tailored prevention measures. And that is what we do here at Diet and Health. At Diet and Health, we look at you psychologically, we look at you socially, we look at you physically, we look at you from even spiritual perspective. And then we see how we can, prevent the occurrence of the disease with what we call optimal individually tailored prevention measures. That's what we do in preventive medicine. So that you look at yourself today, there is no high blood pressure, and that thing is running in your family. You look at yourself today, there is no diabetes, and it's running in your family. Today you look at yourself, there is no stroke, no dementia, and this thing could be running in your family. So you say, I don't want to have it, so what do I do? And because you need to do something, you need to be tailored into preventive measures by diet. That's what we call medical nutrition therapy. So with medical nutrition therapy, you can prevent any disease. You can also program your meal and then consist in eating that particular meal, and then that takes you into your life, not for you to eat what you like every day of your life, and then when the sickness occurs, you now begin to run helter-skelter. So preventive medicine is all encompassing. Now, preventive medicine distinguishes between 3 different areas of prevention. Okay, I talk about primary, I talk about secondary, I talk about tertiary. Okay, but let me not emphasize much on all of that. Okay, now in today's world, when you meet somebody on the streets, is either he wants to do something to prevent sickness, or he has been sick, he wants to recover from that sickness. That is one part. And then the other one is, you meet people who are also struggling not to get sick, yet they don't know what to do. So at that point, what do? You look for experts. You look for experts who are going to hold you by your hand. They will hold you by the hand and take you in a journey. And that journey has a destination. What is the destination? The destination is, or the objective is, you want to prevent one sickness or the other. And so, your mentor now takes you and is there with you day in, day out. We may spend maybe 1 month with you, 2 months with you, but we have decided the minimum we have spent with individual patients has been 3 months. So we can stay even 6 months with you. There are cases we stay 1 year to make sure that you achieve what you want. And this may include reversing the occurrence, what may have happened, like the BP, like the sugar, like the dementia, or whatever. And then there are cases too, I don't want to have it, and we give assurance that you are not going to have it, as long as you are willing and are ready to follow instructions. Okay, so please, preventive medicine does a lot, to rehabilitate, and then stays and cures and support the being in their recovery process. Because everybody who is sick wants to recover. And when you recover, you want to stay never to get sick anymore. Okay, so let me look at what I call importance of preventive medicine. Now, one of the greatest advantages of preventive medicine or preventive care, is individuals to understand that he can prevent any disease. And that we all not only want to grow old. Listen, we all not only want to grow old, we also want to age healthy and happy as possible. That is my singular objective. Not just to grow old, but to grow old, healthy and happy. Not to be a burden in your old age. That is the most important aspect of preventive medicine. Now, what age? People ask me, what age should we begin preventive care? And I tell them, any age will come to your consciousness. Any age, because a number of persons may have lived their life up to the age of 50, 60, even 70, without knowing that they could do something to prevent one disease or the other. So any age, you come to a point where you understand that you must embark on preventive medicine, even though sickness has occurred already, and you start. But I tell you, the best time to start preventive care is in your youthful age. Let me say from the age of 30. Because at the age of 30, a number of young men don't have BP. A number of young men don't have diabetes. A number of young men do not have all these elderly people sickness. They do not have arthritis. A number of them at the age of 30. So at the age of 30, you begin preventive care. And so when you begin preventive care at that age, when you never got any sickness whatsoever, and then you begin a journey where you don't want to have what is very common these days. What are the common diseases? These days, hypertension is common. Diabetes mellitus is common. Arthritis is common. Ulcer is common. Cancer is common. Stroke is common. Oh my God. And these are degenerative conditions. These are cardiovascular diseases. So at the age of 30, you begin to look at yourself, so I don't want to have it. So what if you don't want to have it? Then you mean you have to start a journey. So in order to ensure a society with the best possible health status, preventive medicine begins at a young age. There are special offers for children and young people to show them how to pursue, healthy lifestyle. So people of God, wherever you are hearing me from, hear me and hear me out. It is important to embark on a journey of preventive care. If you do not want to have any of these diseases, listen. Even though it is running in your family, I mentioned before, because I tell people that gene is a loaded gun. Gene, that's genetic factor, is a loaded gun. But it is your food and lifestyle that pull the trigger. So you don't blame whatever thing that happened to you on your genetic makeup. No, you blame it on your lifestyle and what you eat on daily basis. You see, I'm so grateful to the fact that God created the world and gave us abundance of food. Man, this is God. God is so awesome. God created the world and endowed the world with variety, a number of things you need to eat to enrich your health. But do you know we have suddenly turned away from where God placed us and take a different dimension, different direction. And for that purpose, it looks like God did not do anything for us. It looks like God abandoned us. God is all-knowing God. So He made provision beforehand. He made provision that can prevent you from getting sick. He made provision that can help you recover even when you've gotten sick. He made provision that can help you to live longer and live healthier at old age. That is God for you. But do you know the reason our afflictions are multiplied is because we have abandoned God's ordained provision and take to our own way. That is why it looks like God is no longer interested in what we are doing, but God is still interested. You see? So for adults, the focus is on ensuring performance at work. How can you be at the age of 60 and you are looking old? You can't jump, you can't run, you can't walk fast at the age of 60. Being active at work in everyday life, and then preventing diseases that are typical of these age groups. Because when you look at the people of 60 and 70, it looks like every one of them is meant to have diabetes, is meant to have the hypertension, is meant to have arthritis, is meant to get sick or to have osteoporosis. No, it's not supposed to be like this. It is because of the way we have lived our life from the age of 30 or youthful age, and then we lead them into old age. Now, you can make a change. So how can you live a younger and longer life using preventive care? You see, I'm going to give you a few guidelines on what you are going to do if you want to live a healthier and longer life, so that when people look at you, you will be an epitome of good health. epitome of good health. Now, if you want to build a powerful preventive plan with your health, you can meet us. Diet and Health is there to help you, because we are here to help a number of persons, help the society build a good health. And then your good health, you won't regret it. But do you know what I have discovered with a number of persons? When they start their journey with us, along the line they turn away. They go on their own. And so the moment they walk on their own, we also left them and allow them to live the way they want to live. When something now happens, they come looking for us again. It's not supposed to be like that. It's not supposed to be like that. So for you who have determined, I want to have a healthier life at my old age, then you must be deliberate in doing what is right. Okay? You must be deliberate in doing what is right. Because if you begin to do what is right, I can assure you that you are going to overcome a number of problems. There is what we call atherosclerosis when we are talking about high blood pressure. Now, when we say atherosclerosis, it's a condition that happens on the inside. So atherosclerosis reduces blood supply to your extremities in your body system. Okay? Now, when that happens, okay, let me say, in addition to chest and shortness of breath. So the moment you have atherosclerosis, you begin to have chest pain. Number one. You begin to have shortness of breath. It's like something is interfering with your breath. Your breath is not flowing the way it used to flow before. Okay? And then another symptoms that is associated with atherosclerosis is coldness. Coldness is not general coldness, so it is on the limbs. And then you begin to have what is known as numbness, especially in the limbs too. And then you begin to have what is known as unexplained pains, weakness in your legs and arms. Why? The reason is because you are suffering from poor oxygenation. If your heart pumps properly, what it does, it sends oxygen and pumps blood to the extremities of your body, to the arms, to the limbs, to the lower region, and every part of your body system. But the fact that there is interception, there is obstruction in your artery, which led to maybe what we call the atherosclerosis. So the blood and the oxygen is not flowing properly anymore. That's what led to your problem. So that's why you have, coldness. Sometimes the leg could be swollen because there is no proper oxygenation. Okay, the metabolic processes is even low. That's a problem with atherosclerosis. So you need to prevent this. You can prevent it. And it is important to know there are things that can lead to this. And what is it that can lead, that may have led to this? What probably led to this are the things you eat. Yes, of course. In medical science, you will always hear such languages as etiology unknown. That means it looks like the medical science may not totally explain the cause of this problem. But let me tell you as a dietitian, that when you insist in eating food that does not contain oxygen, that means you'll be deprived of oxygen. And the oxygen in your body may not be enough to foot the needs of the body at a given time. So oxygen deprivation can lead to a number of things, number one. And then number two, then when you continue to also eat the type of food that can produce cholesterol, bad cholesterol, the low density lipoprotein, and these things are left in your arteries during blood flow, along the line, it would constitute obstruction in your artery and narrow the artery, which eventually may lead to what we call atherosclerosis. So, the food you have been eating, which may include oil, it could be vegetable oil, it could be all those bad oil, it could be frying of food, It could be excess acidity in your body, eating bread, drinking milk, and all of that. And then having been doing these things over time, along the line it begins to build up. And then when it began to build up, you may not have known that there is, a problem of arteriosclerosis being set up in your body system. For us here, in this part of the world, because we don't go to hospital to do checks, we feel headache, because that alone can cause headache. What you do, you buy paracetamol or you treat malaria when it is not actually malaria. And then the problem continues to build up and continues to build up and continues to build up. And it gets to a point where it becomes so severe. So as that goes on, your blood pressure rises. It moves from the the diastolic blood pressure could now move from 60 to 70, and then the systolic now moves from 100 to 110, and each of the levels continue to move. The movement will now depends on the condition of the renal condition and the condition in the artery, and before long you have what is known as severe hypertension. And that severe hypertension sets in. And as it sets in, what do you need now? You need drugs to relax your nerves and blood vessels to be able to pump oxygen, pump blood and all of that. But that is not a cure. It's just a remedy, just a palliative measure. But I tell you, if you had embarked on what we call preventive medicine, by avoiding some certain food you eat over time, maybe 3 years ago, 5 years ago, 10 years ago, consistently, that condition will not occur. As I'm talking to you now, my blood pressure still remains as what it used to be 20 years ago. It didn't go up. Why will it go up? Because I'm very careful what I eat on a daily basis. So I should be an example, because what I'm telling you now is typical among everybody. But that when you are careful with what you eat, it will be difficult to incur any of these problems. So you want to, remedy the situation, you need to begin to look at what you eat on a daily basis. And then another condition known as arrhythmia is equally part of what we call cardiovascular problem. Causes of an abnormal heart rhythm, which include diabetes. The moment you have diabetes, your heart rhythm will change. And then another one we call CAD, coronary artery disease, will set in. Heart defects, which include congenital heart defect. Okay, so all of these conditions are the things that could happen in the heart. And then you say, wow, what must have happened to me? Do you know that there are some people whose heart condition begin when they were in the womb, but that is very rare, in a very rare conditions. That is the one we call congenital heart disease or the heart defect. That one could happen when the child is in the womb, but it's very, very rare, very rare. Okay? So, as you are listening to me now, I want to draw a conclusion here that you can prevent any disease. You can prevent asthma. You can prevent hypertension. You can prevent diabetes mellitus. You can prevent arthritis. You can prevent osteoporosis, the weakness of the bone density. You can prevent, dementia that happen to elderly people at their old age. You can prevent it. You can prevent any of these diseases. So what do you want to do now? Is to embark on a journey of preventive care. So what do you do? In preventive care, it requires a lot of discipline, because what you eat in the morning may not be the best breakfast. What you take in the night may not be the best breakfast. So what will you do now? You begin to incorporate fruit and vegetables in your breakfast. Forget about eating as a king in the morning, and so on. No, man, that is not the process of preventive care. In preventive care, you are meticulous about what you eat on a daily basis. Okay, that's number one. And then number two, you are deliberate about your movement, your activity. You desire not to be lazy. Even if you were naturally lazy, you program what you'll be doing on daily basis, spending like 1-2 hours doing that thing in a workout or by way of exercise. That is number 2. And then number 3, you learn to be happy all the time. Of course. Number 4, you select your food. So you can't just select your food when you do not have the knowledge of what is good and what is bad. So look for a good dietitian. Diet and health might be of help if you are interested. Okay? So if you want us to help you, our number will be given to you toward the end of this program. You can reach out to us. And then we'll be there as your faithful partner, guiding you into a journey of good health and preventive care. And then you'll be happy. Okay, so please, make up your mind to live a healthy life. If you want to reach out to us, our address is 4 Udeme Moses Street, off Vision Road. Okay? Nsukara or Fort, near University of Uyo permanent site. Uyo. You can call us on the number 09068205671. I love you. You'll be fine. Thank you very much.
For healthy diet, disease prevention, your health maintenance, diet and health be answer. Emotional health, healthy food and growth, whether young or old, diet and health be answer. For divine health,